There are standard tools available, such as Tweak or TACE, but we know that often a conversational approach, a more casual approach to the conversation, will actually be best for many women. It will help create trust between the physician and the woman, and it'll give you a foundation to build on as you actually start talking about the more difficult areas. And we also know that starting out with a general question is often the best way of introducing the subject. So something like, what do you know about? Or what have you heard about? For example, just as an opening statement. And then actually hear from the woman where she is, what is her information, and what does she need to actually flesh out the picture of where we are now. Secondly, as we talk to women about this, I think it's really good to ask permission. So for example, something like, would you like to know more about the impact of alcohol on women's bodies or the impact on the pregnancy? And if women actually identify that as an area of interest for them, that's an opening, and then we have a dialogue instead of a monologue. Thirdly, I think it's really good to use general statements because it normalizes it. So for example, I might say to one of my patients, many women will experience this during pregnancy or alcohol use during pregnancy. Or I might say, a lot of women that I speak to will mention this as an issue. And so by doing this, what I'm trying to do is make women realize that they're not alone, it's not a unique thing, and that it's completely normal for me to bring this up in the context of the interview with my patient. Finally, in terms of talking about this, I'd like to finish by connecting the information with the woman's experience in her own life. So I might say, for example, after having given her the information, well, what do you make of this? How does this fit in with your life? How are you feeling about this conversation that we're having right now? I think that often will just close the loop and bring it back into the woman's personal experience.